Are you a first-time mom looking to prepare for labor? Well, then this video is for you because I'm going to give you my top 4 tips for preparing for labor that I have given hundreds of women that I've worked with over the years. So stay tuned. If you don't know me, hi, I'm Dr. Brenda Heineke. I'm a pelvic floor physical therapist and owner of Revitalized Physical Therapy. Make sure that you send this to your other mom friends that are looking to prepare for labor as well, because we can all help change women's health care and have a better, smoother delivery. So tip number 1 is stop doing Kegels, ladies. Kegels are not the answer to prepare, and I'm gonna tell you why. So this is all pelvic floor inside here, all these muscles, and if you look at the opening here, that is where baby is coming out for vaginal delivery. And all these pelvic floor muscles, they have to stretch and expand and lengthen so that baby can pass through there. If you're doing Kegels, what happens is you're tightening the muscle. And when the muscle is being constantly tightened all the time, it makes it really hard for it to relax and lengthen. So during delivery, it makes it much harder for these muscles to stretch if they're too tight, or as us pelvic floor PTs call it, overactive. Same thing. So stop doing the Kegels, and we really want to focus on relaxing and lengthening the pelvic floor. So that leads me to tip number 2. We're going to work on belly breathing instead. Now, hear me out before you're like, come on, breathing. In a perfect world, the diaphragm and the pelvic floor work together. So as you inhale, the diaphragm relaxes, and so does the pelvic floor. As you exhale, they both contract. Now, during pregnancy, it gets much harder to use that diaphragm because baby is taking up a lot of space. But the more that you can practice that and the more you can get diaphragm moving, the more you're gonna also help lengthen that pelvic floor and help it stretch and relax. So really important to just really focus on that breathing to lengthen versus those Kegels. Tip number 3 is another pelvic floor stretch that I really love to do. It's called the adductor rock back, and this really helps stretch and lengthen those muscles that I showed you right here. So even if you're not really feeling it there, trust me, it's working. And this is so pregnancy friendly, it's a great way. You may have seen other ones online telling you to do happy baby or this really, really deep squat, which definitely can be helpful, but sometimes really difficult and uncomfortable when you're super pregnant. Trust me, I know, I've been there. So try this, rocking back and forth, just gentle, it should not be painful, and you can do 5 to 10 on each side. Tip number 4, my last and final, obviously I'm biased, but pelvic floor physical therapy is by far so helpful when you are working to prepare for labor. What we do in pelvic floor PT is actually manually release these muscles. So we're going in vaginally, putting pressure on them to help them relax and lengthen so that they're not tight during delivery. We created our own protocol here and found that women had less tearing, less severe tearing, and shorter pushing times. So highly recommend working with a pelvic floor physical therapist. Bonus points if they're a certified birth wellness specialist, because then they've been trained with our proven, researched protocol. So definitely look in your area, and I'll put links below to help you find someone. So make sure, if this was helpful, I would love it if you shared it with your closest mom friends, and make sure you leave me a comment and let me know which tip you love the most.